So my name's Neil Lilly and I'm the Senior Provincial Executive Director for Patient Care, Communications and Planning at BC Ambulance Service. That entails looking after the 3 emergency dispatch centres across the province, also our Patient Transfer Coordination Centre, which looks after all our area resources, and also the Patient Transfer Network, which works with the health authorities in transporting patients across the hospitals. So when you call 911, the first thing that's going to happen is an operator is going to answer and ask whether you require the police, fire or ambulance. When you ask for the ambulance, then you'll be transferred across to one of our emergency dispatch centres, where a call taker, the first thing they can ask you is what city is the emergency in. They can ask you for the exact location of that emergency, so it's imperative that you know where you are. And then they can ask you for your telephone number. Now once they take this information off you, they can ask you to repeat that information again, purely because they need to ensure that the address is the right address, and also if your call gets disconnected, they need to ensure that you've got the right phone number so they can call you back. So once you've given your address and telephone number, the call taker is going to ask you exactly what's the problem. You need to explain exactly what happened to that patient and why you're ringing 911. Once they get that information, they're going to run through a series of questions with you to try and ascertain what type of response is required for that patient, whether it be an advanced life support response, whether it be a basic life support response, and how quick you're going to need that ambulance to respond to you. So please be patient with the call taker. They are experiencing what they're doing, and they need this information to make sure you get the help, the right help, when you need it. So a lot of people think because these questions that a call taker is asking you is going to delay the response of an ambulance getting to you. That's incorrect. The call taker is only responsible for dealing with the patient and dealing with the caller at that time. In our dispatch centres, we also have dispatchers who are responsible for dispatching the resources to the scene. So whilst this 911 call is in progress and the more questions are being asked of you, a dispatcher is already looking for available resources in your area to decide which is the best resource to send to you. And once they've got that information for you, the ambulance will be on its way as soon as it can.